My name is Maryjka Beckmann. I'm the widow of the founder of AAR, today the largest healthcare provider, private healthcare provider in the East African region. We've also got a sister company in Central and Eastern Europe called Medicover, which was started by my husband. After my husband's death, about 11 years ago, I decided to join the company. My vision was, like his, to make healthcare sustainable, affordable, eventually to be affordable by the lower income groups, of which makes up 90% of the East African region, where we are doing business today. Well, I don't think that only AAR is doing this. I think this is the healthcare in general, that it's not sustainable only to give branded medication. It's a little bit like not everybody can drive with a Mercedes. Some of us have got bicycles, some of us have got smaller cars, and it doesn't mean that they're bad. There's a specific need for every vehicle, every drug. 95% of medical cases are just ordinary cases. And of course, there are these enormous tragedies. They're the very specific 5%, which have actually, in some ways, changed the whole aspect of the medical development, certainly in the developed world. Without that, we wouldn't have gone as far as we have. So I'm not denouncing it. I think it's excellent. I think it should go on. But there is like going to the bottom of the pyramid, so to say. We do not all need the branded medication. We have to go on. We have to keep developing them. But the ordinary generic drug answers the need of the ordinary health needs of the ordinary person around the world. To come down to CSR, when I can't remember when I first heard the three letters put together, I thought corporate social responsibility. But doesn't that start with the individual? The corporate is made of the individuals. So it's our responsibilities as individuals in a company to make the difference. And everything I was talking about, and even after your presentation the last 2 days, I still find that a lot of people are going away thinking about CSR as what I call community engagement. And I hope, especially with your conclusion, that will change. Wangari Maathai, the lady who's been quoted, a Nobel Prize winner, is one of my heroes. She's done an extraordinary function, especially for Africa, as a woman and as an environmentalist. We can make a difference, each and every one. The healthcare sector is being impacted negatively by the negative and environmental changes that are taking place. We know all that. So we had to, after doing all the necessary bits of what we called corporate social responsibility, governance, labor, welfare, etc., we have sort of narrowed it down to the fact that we have to try and get our employees involved in trying to impact on their brothers and sisters. Who are the ones living in the slums? Who are the ones living on the peripheries of our cities, in what we call the fringe urban areas, which are mostly slums? So what we have started, or I started many years ago, this is about 10, 12 years ago, is to actually target schools who are one of the biggest users of firewood certainly in Nairobi and around the country. There are about 17,000 schools in Kenya alone, 2,000 schools in Nairobi itself, and say, why don't you make that now sustainable? Not only does it impact positively on the environment, it answers the question of let's plant trees for our own use. I don't know how many thousands, I don't have all the different figures with me, but there are thousands and thousands of tons brought in daily into Nairobi itself of cut firewood. Let's take responsibility for this as individuals. So, as said, we started this about 12 years ago. Today we're actually harvesting trees in schools. Now schools, which I spoke to 12, 10, 8, 6 years ago, are starting to call me back, telling me, come, there was something you told, now we can plant these trees. Most of the schools in Nairobi, in Kenya, perhaps less so in Uganda, but certainly in Tanzania, lie on very large tracts of land, anything between 5 and 20 acres. So it's very easy to plant trees on the peripheries, which are then eventually harvested. And we are addressing quite a few things. We are addressing the carbon dioxide intake by these trees. They work as windbreaks. As we specifically only plant indigenous trees, they actually attract birds. For example, the other day, when we were harvesting the first trees in the school in the middle of a slum, we actually had some very exotic birds. We are partnering with wildlife clubs. We are partnering with HIV trusts. We are quite a big list and long list of partners, all trying to impact on the health of people. Without health, we consider that there is no education. Sick children cannot come to schools. Our motto is that the money that you save on having to buy firewood, you use for the basic health needs of your schools. By our, when we have our health camps in the schools, we have realized that the biggest issue, health issue in schools is worms, or are worms. Children are riddled with worms. If they are not dewormed twice a year, they are competing for the little nutrition they're getting on a daily basis. By deworming them biannually, you can actually improve the output, academic output of those children enormously. We're starting to show that. We actually have an example of a school in the Mukuru slum. So that is what now, today, I'm actually concentrating on. I'm starting to get people who can actually go out, speak to the schools. As a trust, which then I started about 4 years ago, I'm planting seedlings. So if the school agrees, we can't hold them legally to this, agrees to do this, we are planting trees on their school grounds, and we'll keep doing that every rain season. So it's not just a one-off thing. This is a long term. We are looking for partners in this, because at the end of the day, it'll end up being quite expensive. At the moment, it's something that is being paid by AAR, the health company which was started by my husband, and by the trust which was then set up by me and the company.